So I want
Amazing.
to start off with the future. We're going straight ahead because we're
Mm,
entering a new year with all these new trends and everything else. I want to talk about the future of aesthetic medicine first as our first little section.
mm.
But I want to get back to basics. Like, what does natural enhancement actually mean now in 2025 and in 2026, and how do you achieve it?
So I think it really depends on the patient that we're looking at in front of us. Everyone's definition of natural is different. For me personally, I think natural enhancement is definitely about making somebody look like themselves, but a better version of themselves. So far, if you're asking me in terms of like the next 5 to 10 years, I really think that aesthetic medicine is shifting into a very much natural study. So it's about looking like yourself, not somebody else. And that's the main thing I say to my patients when they come into clinic. I say, look, if I could wave if I could wave a magic wand and kind of give you what you want, what is it that you'd want? And they'd say, oh, well, I'd like a little bit of this. I call this a 3 point salute. Or, I want a little bit of a pullback here. I want some nice skin. And I say, well, in your view, are you still looking like yourself? Are you wanting to look like somebody else? Do you have a reference for me? Half the time they'll say, I just want to look like me. I'd like to look like me. And the other half is, well, no, I kind of want to look a bit like some of the Kardashians. I want to look a little bit this, I want to look a bit that. And I'm thinking, it's a bit of a tall ask to come into a non surgical clinic and ask that. So, yeah, I would definitely say my focus is definitely more natural. And that's where I see it going in the next 5 to 10 years.
How do you balance that? Because I can imagine you have people coming in with images of like all these celebrities, and it almost feels like fashion has
Mm.
trends. It feels like our bodies are now having trends. How do you balance that?
With great difficulty,
Talk
I
us
have
through
to
it.
say. Um, I think the expectations generally I have to address there because some people come in and bless them, they have absolutely no idea what they want with their skin. They're like, Dr. Cass, I don't know what to do. I don't know. And I say, well, that's fine. We can have a look in your skin. We can see exactly what's going on there. Others come in very directional and say, well, I want a facelift like, Kendall Jenner or, and all this. And I'm just like, well, do you have £300,000 and do you have another surgeon to go to? Because I can't do that. Um, I generally think balancing it is very difficult. And when they come in with a picture and they show me, I say, look, you're, for example, a handsome Caucasian gentleman. If you show me a picture of an Afro Caribbean person with, an ethnic kind of genotype, if we like, a specific appearance, I can't give you that. I can't give you a jawline when there isn't the bone structure to support it. So I think it's about being honest. And I think honesty is well received with the majority
Mm,
when you say it tactfully.
tactfully is the key there. And I'm wondering, are you seeing or have you seen a shift in your career, like in the past few years of like the mix of genders that are coming towards? Is it now more males or
Mm. Good question. Actually, do you know, when I first started, we started on the grand prestigious Harley Street, and that's where I did my first ever job in aesthetic medicine. And let me tell you, it's not everything it's made out to be. It looks a lot more glam than it actually is behind the scenes. But the gender kind of presentations have been interesting. So we found that our main goal was to kind of just give natural rejuvenatory aesthetics, and we saw a lot of women coming in for lip filler, for cheek filler, for different types of fillers. But I think gone are the days of filler now. Since kind of rejuvenative aesthetics have come in, and since I've been a bit more kind of medical in terms of my offerings, we've been seeing a lot of men actually, to be fair, which is really nice because they all come in to my clinic, which is very much not, your standard bright pink neon signs and like plush chairs and loads of different like kind of colors that kind of might put a guy off typically. So I'm very neutral in my clinic setting. It's very much like this room actually. It's quite nice. But we get about 50-50 split now, which is lovely.
wow, I thought that you'd say, "Oh, it's going to get there in the future, but we're here now."
We're here. Well, definitely in my clinic. I do a lot of hair regeneration, joint stuff. So I see footballers and athletes for joint injections, regenerations. We see a lot of men coming in mainly because their wives are coming in to see me and they drag them in. But at the same time, it's really nice because they also feel comfortable to come and have a chat as well.
Do you think that the stigma has like it's become like going to the dentist, getting your hair done, again buying new clothes on trend, like, and it's become more affordable, I'd say. We know with different payment plans, etc. But do you think that's what's allowing more men to come forward and be like, "Hey, I want to look like this," or
To be honest, I think when you see other men getting treatment, I think that's the main thing. Like
Mm.
on my social media or my profiles, I'm very heavy on first of all advocating for men, whether that be men's kind of mental health. But I also talk a little bit about and a little bit about, men's kind of overall goals, whether that be physical, emotional, psychological. And a lot of men come into my clinic, and luckily I've had quite a lot of content from it. So that's the main driver that brings them in. It's actually, well, I saw that chap from Love Island came onto your into your clinic, or that guy who was on Towie came into your clinic, and I was like, yeah, definitely. And this is what men do now. It's the new trend. I mean, it's not like Shein or Amazon. You can't just go in and just buy treatment, but maybe one day we might see that. But I think when they come in, it's about making them feel welcome, and definitely that's kind of what drives them, in my experience.
Right. And you just touched upon like being an advocate for men's mental health, and I
Mm,
think that's super important, especially being two males here speaking about it. Um, when it comes to men wanting procedures and stuff, like you mentioned,
mm,
there's so many components like mental,
mm.
physical. Is that something you speak to them about, etc.?
Absolutely. I think as part and parcel of my consultations, really, to be honest with you, I do ask about mental health with everybody. Because people can come in to see me for the wrong reasons. If someone's going through a crisis and they're, for example, feeling forced to have a treatment or under the coercion of somebody else, which does happen, and I have seen it, safeguarding is a thing. And I think we definitely do have, a right and a duty to our patients as medical professionals to ensure that they are safe. So medical screening in terms of mental health is really important specifically, and I always ask my patients about that. And I do routinely say like, "How are you feeling today? Are you feeling well in yourself? What's your reasoning for coming in? And do you want to talk a little bit about it?" I always open up the consultation. My consults are a bit longer than the NHS. I give my patients an hour, so we have time. And time is a beautiful thing because you can really build a rapport with your patients, talk to them, and in some ways make them feel like they've been listened to and heard. And I think
Mm,
that's super important.
it is because you said people might be coming for the wrong reasons,
Mm,
given into like social media pressures of fake and AI imagery they're seeing online.
mm.
And I guess, have you struggled or has that been a challenge to kind of
God, yes, yes. I mean,
tell
it
me?
was just this morning. I mean, I mean, just to come off aesthetics for a moment. I saw this video and I was like, "Oh my God, that's so cool!" And I showed somebody, and he messaged me back. He's like, "Dude, that's AI." And I was like, "But this is so convincing." And he
Mm,
was like, "Yep, that's AI." How do you know? It's just you can tell by certain movements, the way the quality of the video is. But it's really strange because even within the aesthetic world now, AI is taking over with many things, right? And whilst I believe it's a great tool, we can leverage it for wonderful things. And there is a company that I'm working with that uses AI for wellness and kind of within the beauty and healthcare and longevity space. It's a fantastic tool. The other thing is that it can be really dangerous. And we're finding consistently with the younger generation, with Gen Z particularly, I call them Gen Z, because I'm old. Although I don't, might not look as old as I am, but I'm kind of creeping up to mid 30s, coming towards 40s, and I'm thinking, you know, the expectations are high. I had a patient come in showing me a video of this woman. It was clearly an AI derived video, and she was like, "Oh, look at me! I snatched my jawline with this device." And I looked at the video and I was like, "Is this realistic? Or do you believe this?" And she's like, "Yeah, I want this." And I was like, "No, you're going to be looking for a very long time because it's never going to come. And I think the expectations are very high. And there is this culture of instant gratification with the younger generation, I find. Um, Everything seems to be routinely available, readily available. And I think it's really important to touch on, if I'm being completely honest, the nature of the quality of content out there. AI or not, we have a lot of influence from celebrities, from social media, but also routine people using platforms like Twitter or OnlyFans to hypersexualize content, make these, standards of beauty and setting these standards which are totally unrealistic. And patients have come in wanting, you know, gender enhancement, like kind of reproductive organ enhancement, certain things to make them look a certain way because they want to be more desirable to the same or to the opposite sex. And is that really for you, or are you doing that for someone else? That's the question I ask. And I think these expectations really do seep in, and we have to kind of just disentangle them very carefully. It can be a tricky conversation, but we kind of get there.
Yeah, but it's good that you say you spent that time to get to know the reason why, like,
Mm,
and also set the expectations for them as well. Like this is AI, this is not real, and
Mm.
I think it's. I want to come back to the men's mental health and stuff a little bit later on, and continue with the future now of aesthetic medicine.
Mm.
And I just want to ask you, like, how do you see the future of aesthetic medicine evolving? You know, especially because we talked about AI, so with natural, with ethical, and patient-centered treatments.
I think the future is definitely going to be regenerative medicine. If I'm being
Okay.
honest, I think fillers are going to go out of fashion if they haven't already. And I think the focus will always be using your body to do the work. So we can carefully and very kind of selectively make your cells do better. We can get your body to function better. We can improve its vitality from within with means of supplementation, giving you what you need. And I think that's what really works in terms of a medical space, right? You want to know that your body is doing the job it's supposed to do. I always describe the skin as an organ, to be fair. And I tell everyone, look, I'm a GP, right? So I'm a humble GP. But you come into my clinic and you've got a problem with your blood pressure. I'll say, okay, take some medication because high blood pressure can cause strokes, it can cause heart attacks. No doubt whatsoever. Patient will take the medication, come back 6 months later for a review. You have your biannual reviews, your blood tests when you need them. Don't bat an eyelid. Lung health, cardiovascular health, all the same. Why would the skin be any different? Your skin is prone to disease, pathology, cancer, inflammation, pigmentation, acne, whatever it might be. It's an organ. It's the biggest one of the human body, the most sensitive and fragile and stubborn one, might I add, but it is the organ we have. And I think if we're looking at the future, all of our patients usually are going to be quite savvy and tuned in. And I think that's going to be the process of where we go with treatments. Regenerative, longer lasting, whether it be means of things like PRP, using your own blood, stem cell therapy, rejuvenative injectable therapy, joint rehabilitation, overall body health. I think this is where it's going to go for sure.
Okay, but in your opinion, why do you think natural enhancement is kind of becoming the new gold standard going forward?
Because we've seen the opposite,
Okay.
on social media and in reality, if you look at some celebrities and you see all of these kind of like practitioners talking about, well, what do you think she's had done? Or look at Anne Hathaway, she does look fantastic, by the way. And they've all had kind of deep plane facelifts and various other kind of surgical intervention for sure, But I think we've seen the opposite very much so with the duck lips. We've seen the hamster cheeks. We've seen everything go wrong. And those are the ones that make it onto social media, right? They make it onto news outlets. And that's the main deterrent that people, to make them not want to come and see me. So I think because of that being in existence in its whole entity, that's probably the reason why patients want more natural results now. They're
Hmm.
not coming in anymore saying, "Well, I want the duck lips. I want this to be like this," And very rarely am I saying like, "I want these Russian lips, or I want this, or I want that." They're coming in saying, "I want something that's going to make me feel a bit better, and I want something that's going to be natural in line with my body. That's going to be in keeping with my expectation." They could be
Hmm.
quite specific about that for sure, and that's fine. It's your body, right? But yeah, that's definitely why I think people are now going more towards natural medicine.
Right, and we're seeing great jobs online, like you said. Anne Hathaway, Chris Jenner, like they're looking amazing.
They really are.
Um, but what is your personal philosophy on aesthetics right now?
Unregulated, I think, at the moment in the industry. I think aesthetics is a great career and a great profession, and one that's really rewarding in the hands of someone who can wield that weapon correctly. And when I say weapon, I don't mean cause mass destruction. Let's clarify that. I mean, using it as a tool for greatness and improving quality of life. And I've seen patients come to me having been treated with similar treatments, but in the back garden of somebody else's home or in the back of a car. Whilst it's moving, by the way, can I add? Driving, trying to multitask, but I would not be injecting somebody's face whilst I'm in a moving vehicle. It just wouldn't work. Um, Again, high risk procedures you'll have seen on the news media outlets about BBLs, increased risk of death. There was funnily enough, this is a really tragic incident, but there was a practicing aesthetic practitioner herself who has had the treatment. She had a BBL and a mother of five, and she passed away because of the complications from it. And that happened earlier this year. So, I'm a huge advocate, and I think the philosophy is definitely sound, but there has to be some regulation. There has to be some strict, tight regulation when it comes to our degree, our practice, and it needs to be done in the hands of somebody skilled.
Sounds like you. Yeah. But I want to go back to like your why.
Mm.
What's the red thread? What sparked your interest in all of this?
It was actually one of my friends who did it before me.
Mm-hmm.
So, I'm sure he won't mind me mentioning his name. So, one of my great friends, Rosh, he actually did the job before me. We qualified together. We have similar lives, you know. We kind of got um married at the same time. We had kids at the same time. We moved around at the same time. We ended up graduating from the same medical school. So in some ways, we're very parallel. So it would only stand to reason that I would follow suit at some point, even in my career. But he was like, "Cass, do you really think that you're fulfilled, or aesthetics is pretty good, I've gotten into this." And I thought, oh, do you know what, it's all just Botox and fillers, it's not really my cup of tea, to be fair with you. And he was like, well, just give it a go, see, go to training academy, see how you find your feet. And I thought, okay, let me try it. So I decided to pursue the career, and that's how I got into it. I went to a training academy. They got me to inject a dummy mannequin, which is nice.
Okay.
And, I felt wholly underprepared and decided to do a level 7 qualification, which is an equivalent to a master's degree in aesthetic medicine and cosmetic dermatology, just because I just didn't feel like I got enough. Um, and following that, I managed to then work on Harley Street, treat real life patients through my case studies, get the confidence, practice the hand. And then over the number of years, I was like, do you know what, this is quite nice. Um, it's a great shift from the NHS because you can give time, you can give your effort, and it's very much, building relationships and improving patients' lives as much as people think it's not, and this is all just vanity or cosmetics. I really disagree with that. I think my entire career is based on the premise of improving quality of life. Whether it's laser to treat fungal infections, whether it's tattoo removal for a bad decision made in Las Vegas, whether it's, impacting someone's psychological well-being by, remedying damaging acne, which has a huge self-esteem and mental crisis effect within our adult population and also adolescent teenage population too. And I think that when we do all of this together, we can really make great brown. So that's why I continued with it and why I found my flair with it. But definitely coming into it, it was all on the back of seeing somebody else, and when you see someone else do something and they're succeeding and they're happy, naturally you think, maybe that could be me.
Right. No, I agree. I think there's this misconception of it, as you said, being vanity. It's all for like something else for like Instagram likes or for social media. It's like, well, no. Are you suffering with acne as an adult? Like, are you trying to hide at home because of it? You know what I
Mm.
mean? So I agree with you. But back on the topic of patients and what would you say one of your biggest patients misconception that you wish patients understood more?
I wish they understood that we don't always need to make you look different. Patients will come in saying and very apprehensive, and they're saying, "No, no, I don't want this because I know what it does." But do you know what it does? Yes, yes, I've seen it on the news. I've seen it on the news. Okay, well, let me kind of enlighten you, open your eyes. That's the biggest misconception: is what I do will render people looking like someone else or looking fake. The F word, not the bad one, but the other one called fake, is the one that I hear in my clinic all the time. They're like, Dr. Cass, I don't want to look fake. I want to look natural. And I'm like, well, you're in the right place because that's only what I do. That's what I specialize in, is using your body to make you look like you, but just better. So that's the biggest misconception. The other misconception I would say, which is a funny one, is that the treatments, it's a money grabbing scheme. You have to keep coming back to have it, and it's a conveyor belt. So once you start, you can't stop. It's a bit like Pringles. You open up the packet, and then when you get to it, you're like, oh God, okay. Well, first of all, there's a matter of getting your hand into it, which let's not talk about that. That's another conversation. But I mean, they say when I start, I don't want to get on the conveyor belt to the point where I can stop. And I'll say to everyone, it's very much dependent on you. You can get some anti-wrinkle injections, you can get a bit of Botox here and there, you can get some skin boosters, to make yourself feel better. By no means is there any need for you to continue that if you don't want to, whether that be financially, whether it be kind of, investing your time. But lots of patients want to, and they look very natural because of it, because of the way that it's done tactfully, and that's the other misconception, I think, is just going down the rabbit hole. I don't think I'm going to be able to stop. And a good person, a good practitioner and doctor will tell you when to stop. If it's getting to the point where it's getting too much, I'll happily say to my patients, I don't think you need that. Sorry. It's not like, we did it. It's great, but any more and you're going to look like this. So, no, it's a no from me.
And I think that's appreciated as well, that honesty of no, or
Mm.
in a consultation, maybe you saying, "Oh, that's not going to balance your face right," or something like that. I think anyone who's just putting stuff into your face, like you said, you should be a little bit weary of, or not continue with. But I want to talk like on this misconceptions or this myth busting. Like, what's one high risk misconception or skin myth that you wish people would stop believing from TikTokers that don't really know anything?
Oh God, okay. Things like beef tallow on the face. Okay, let's talk about it because beef tallow, is just not a great thing to be putting on the face. It's also used for cooking as well. Anything that you can use for cooking, do not put on the face. Okay, I think that's just a no-go generally. Um, Huge misconceptions. I don't need to wear SPF, I've heard. Both indoors and outdoors. I don't need to wear it in the winter. Why? Well, because the sun's not out. But that's not how science works. Ultraviolet radiation, you may not know, but UVA, UVB, blue light radiation even penetrates from your phone, from windows, through windows, from your computer screen if you're on your laptop. If you can get photo aging from your medical devices, so from your electrical devices rather. And I tell patients, I say during the summer and the winter, indoors and outdoors, you need to wear SPF because ultraviolet radiation, guess what it does? Increases your risk of skin cancer. And when you get a skin cancer, it's not nice when it needs to be cut out. And if that cancer spreads to other places like your eyes or your gut, which, malignant melanoma can, it can become life threatening. Why would you risk it? So, alerting people, updating information, right? The other misconception they come in with is sunbeds. Now, we don't see it a huge often, but I do have the odd patient that comes in and says, "Oh, well, I just like to look a little bit more brown," which is crazy because I grew up in a culture where everybody wanted to lighten their skin. Being South Asian, the darker you are, the worse it was in terms of vanity. And I love every skin type, and I think each to their own is beautiful. But everyone who's darker wants to be lighter, and everyone who's lighter wants to be a shade darker. And I think it's crazy because doing something like sunbed increases your risk of, a melanoma by up to 50%. It's ridiculously high stats. And patients will say to me, "Oh, it was only once, and I'll only do it once every year." But the problem is that 10, 20, 30 years down the line, that one session can increase your risk quite massively, and it can present late. So again, that's a huge thing that I kind of tell my patients, like, please be knowledgeable, aware, and do things properly.
This not wearing SPF thing seems to like really catch fire online. Like there was almost this campaign of anti SPF wearers. You as a industry professional, why do you think that sort of stuff can catch fire and spread like that?
I think it's just misinformation, to be honest
Hmm.
with you, because somebody somewhere will have thought, "Oh, well, there's an ingredient in SPF that could potentially be damaging to skin, and there's this link to this study or this link to that that could potentially cause an issue." And with every kind of viral trend that has no medical merit, it's based on something that's either anecdotal, that's been said in passing, or one study which has got literally no clinical base behind it. SPF has, alcohol within it. Alcohol can dry out the skin, but the alcohol is also used to sterilize the skin as well and clean the skin. So, which one do you pick? You know, I don't tell my patients to wear SPF after a procedure because alcohol and broken skin can cause more irritation. Lots of practitioners will do that. But I, knowing the knowledge and the understanding of what's in it, I would be able to advise better. So I think it's just about the more you know, the more validity you can assign to these claims. Ignorance will always fire flare. Always, you see it with politicians, you see it all the time with, people of power who have no idea what they're doing or talking about or giving false promises. They'll be so confident in their claims, but when asked to back it up, they won't have anything. And I think, that gets traction. I think, controversy gets traction and people will jump on the bandwagon and say, "Oh my God, did you know this? Did you know that?" And I see these trends come up and down all the time. And I'm like, yeah, I did know that, but it doesn't support the science.
Mm.
I'm just a humble doctor here trying to educate people. But at the end of the day, if you've got Kim Kardashian telling you a face tape is going to give you a facelift, um, it's not going to happen. But how many people bought the face tape, that wrap that went around the face? It's ridiculous stats, but it doesn't work. But because she's a Kardashian, it gains traction because she said it does. So, and my patients have tried it, but gimmicks are out there. They get traction. Unfortunately, not enough science does. So that's why I'm here, I suppose.
On those gimmicks, do you think there should be something stronger done, like with a law, like to stop the misinformation spreading?
I mean, can you stop someone on social media telling you that something
Can't.
works? Freedom of speech is a thing, right? And that's what it is. Like I could. people have gone to social media or the news and said, "Oh my goodness, this works really well," or I swear by this little pill that makes you lose 500 pounds of weight and whatever," and I'm just like, but it doesn't. It doesn't for the majority, and your body is very different. So you can't stop it, unfortunately. You just have to counteract it and rebalance the knowledge. That's kind of where the biggest problem for me comes in, is that, I have so many people that come in saying, "What about this? What about that? Or I saw this. Oh my God, this Korean stem cell treatment looks amazing, or this looks fine." And I'm just like, that's great for them, but does it work for the majority? Not really.
Mm, that's very real. I want to jump into longevity medicine.
Mm.
Now, for anybody who's listening and watching, what is it if they're new to this space?
So longevity is a funny one. So basically, people think it's more complicated than it is. Longevity is basically using your body's function to improve it and make it exist and function better. So wellness, longevity, or even biohacking, all the terms are used interchangeably. Um, these are kind of methods or measures or things that you can do to improve the quality of your own body's functions, to improve its own vitality and how you feel. So it's using your body as a tool to improve itself.
And what does that look like?
So different ways.
Hmm.
Longevity can be using, specific devices. So it could be using things like, hyperbaric oxygen to help with oxygenation and recovery. Could look like cryotherapy. So, kind of soaring your body down to cooler temperatures to help with inflammation, to help with skin, to help with joints, to help with your systemic or what we call widespread inflammatory disorders and things like that. Cold plunges, saunas, infrared treatments as well to help with collagen production, to help with overall wellness, mood, cognition. There are clinical studies linked to how mental health can also improve by employing these measures like infrared treatment or sauna, hyperbaric oxygen, and
Hmm.
things like that. So that's one side of it. The other side is, supplementation, getting scans, devices. Devices are pretty cool, actually. We are just about to work with a device called the Prism, which is a scanning device that will basically, hopefully in the future, tell you, all of specific markers as to your longevity status. So, kind of bone health, cardiovascular health, and things all in the touch of a button, which is going to be incredible because we find that, measuring these things are going to be so valuable. We want to know. Your Apple Watch can pick up a high heart rate, but is it going to tell you what to do with that high heart rate? Not really. It will just say, "Oh, your heart rate is high. Thanks, but what do I do with that information?"
Mm.
So these measures are basically assigned to help you understand your body better.
Okay, why do you think right now it's becoming such a front runner in the industry? Like, why now?
Good question. Is it a trend that people are hopping on, or is it something that benefits people and they see benefit? I work in a longevity center. That's where my clinic is based. So a lot of my patients use the resources there, and I think there is an element of wellness to it. It's being able to look after your body and improve its function. And I think that's more impactful than any beauty trend that's out there. Um, and I think why now is because people are getting fed up. People are getting, starting to, they're savvy, people are smart. We have to stop assuming that people don't know anything. You can do your research, ChatGPT, as we were talking about AI, might give you good information, it might give you false information, but it's pretty good at giving you a generalized understanding. So patients know a little bit more about things and they know what's not right out there. So I think now in this space and time, people are really wanting to invest in themselves and they think that when they can function better, it's dealing with the stress of life at the end of the day, which we all have, right? So when you're feeling better equipped, whether it be, hyperbaric oxygen session, whether it be something that's going to give you more physical energy to manage the day, to deal with Greg around the corner who's giving you a pasty for £12 and not five, that's kind of what we need. We need that boost in our psychological state, our wellness and mental well-being.
I feel like I've been biohacking and I didn't know it. So is this good? So I take a cold shower every morning. Am I biohacking?
I mean, technically, no, but well, I guess
But it's good,
it's
right?
semantics, right? I guess, yeah. You could say that. You could say that you are engaging in something that's going to remedy, some part of your body function. So yeah, a cold shower in the morning really does help with your autonomic nervous system. It reduces your heart rate. It does really help kind of gear you up for the day, but it also helps with inflammation, puffiness in specific areas, but also really helps on a skin level if we're talking about aesthetics, reduction in inflammation under the skin, pore size. So again, you'll see these people on social media, taking that to the next level and dunking their faces in an ice bath. And I'm thinking, oh, but that's good for puffiness, but actually ice can also burn if you put it on the face for too long. So it's you have to be quite careful. But yes, I would say a cold shower in the morning is probably a good idea. Never thought about it as a biohacking thing though, but I guess,
There you go,
for
exclusive. But is
exclusive,
there
yeah.
any other regular day-to-day easy things that someone could be doing, if they don't have the means to do all this?
Absolutely. I think, being on the right supplementation, first of all, collagen's a big one, right? It's the buzzword that we have
Okay,
in the industry.
so number one, collagen.
hmm Collagen, in some ways, doesn't absorb as much as it should. And depending on the brand and the type that you're using, we have clinical data for the brand that I use, which is the New Skin Collagen Beauty Pro Plus, which absorbs about 60 odd percent more than your regular ones. And also it's got phytoceramides in it to help with environmental stress and antioxidants to improve your kind of, body function, immunity. So again, we're looking at wellness and longevity. We're looking a little bit more at improving body function as well as giving you the collagen and stimulating your cells. So collagen's a big one. The other things are like your multivitamins, your vitamin D. Like you might not know that vitamin D should be taken with vitamin K. If you're taking vitamin D, make notes.
Taking notes,
Uh,
everybody.
Basically, vitamin K acts a bit like the bridge to help that vitamin D get absorbed into the system. So if you're taking vitamin D, yes, you'll absorb some part of it and it's needed for bone metabolism, but vitamin K is integral in the part of vitamin D metabolism and it's needed in some ways to help with its absorption and its transference into circulation. So again, patients might not know that and they're like, oh yeah, I take vitamin D, I'm very diligent with it. And I'm like, with vitamin K? And they're like, no. So again, multivitamins alongside collagen, important. Hydration, water is free. Well, if you're in an airport, that's probably not the case, but it's a bloody bombshell, isn't it? Honestly, depending on where you are. But I think, running tap water at home, absolutely fine. It's filtered, there is this thing about it being recycled between like different houses and everything and coming through. I mean, filtered water will always be better in my opinion anyway. Get yourself a water filter, but hydration, so important because water is the main composition in our body, that 70% of our body is water, and we need it. So hydration is free. Other things you can do as well, looking after your scalp health, hair condition. So everyone thinks that shampooing your hair every day will really help or conditioning it. It's not the case. Your hair and your scalp needs natural oils to kind of fortify the follicle, and it needs a good amount of circulation there. So washing your hair 2 to 3 times a week is fine, every 2 days or so, or 3 days even, but your hair needs health. It needs the oils there in your scalp, right? Now, of course, if you've got a disease that's affecting that, a separate matter, but as far as that's concerned, that's something else you can do. And I suppose getting outside and taking a nature walk, that's also free. Vitamin D gets absorbed through sunshine. Well, it's synthesized through, sunlight. And we get our cholesterol and everything like that, as a byproduct of that metabolism. So we really do, and there's huge mental impacts as well on it, by the way, going out and seeing nature, going to watch the birds outside or taking a stroll, reconnecting with what God put on this world. If you believe in God, if you don't believe in God, then what's existing on this world generally has huge, huge, psychological impact. So from a well-being space, that's super important.
Thank you for those tips. That was, and you can also add my one of the cold shower in the morning.
Yes, no, I
Right,
will
it's
do.
approved by you.
Yeah, that will go onto my website now as an official
Quote me.
approved.
Quote me. Thank you so much. I want to talk about inside out aging because I know
Mm.
a lot of people listening or tuning in to hear what you have to say on this. But why isn't skincare alone like good for aging well?
So, you know, let me use you as an example, right? You've got lovely skin, by the way, and you've got great hair. Not
Thank
everyone is
you.
fortunate in that.
Thank you. I'm
But,
technical. Hear this.
and no, you didn't pay me to say that either. But, let's use you as an example. Say you decided to eat unhealthily and you had a McDonald's every day for a year. Okay. You started smoking or having, drinking alcohol. Ain't no skincare that you're going to put on your face is going to change the what we call the systemic changes or your body changes that will manifest. Your body is a mirror on the outside of what's on the inside. If you load it with things that are toxic and damaging to your organs, the skin being an organ, as we said before, that will manifest in certain ways. You'll be more likely to have pigmentation, you'll have spots, you'll have acne, you'll have various other changes. And of course, your facial profile will change. McDonald's every day is going to change your face, right? You'll be bigger. Your fat pads under your face will obviously change too. So there are these changes that happen with internal health. And I think skincare has a part to play for sure, but it's not the thing that's going to give you your overall function of improving better, you know? That's why with severe cases of acne, there is a medication called Roaccutane, and I do use that at very low dose in some of my patients, despite it having some risks. But on merit, the balance of a low dose Roaccutane at 5 milligrams, 10 milligrams helps amazingly with acne, with body confidence. And I think we're always going to be a mirror on the outside more than we are, based on what's on the inside, rather. That's where the supplementation, the collagen, and all these, healthy diets, lifestyle, longevity factors come into play. And skincare has a part to play, as I said, but it's a great tool to use to amplify the outcome and give you the look that you're going for, but it's not
Mm,
the one that's going to change the skin entirely.
okay. But what parts of the inside out approach would you say make the biggest difference?
I think mainly for me, it's lifestyle. I think it's your diet. I think it's reduction of alcohol. I think it's making healthier choices and drinking more water because water naturally, as we said before, has a huge impact on skin. It really does. And hydrating yourself will manifest with clearer, brighter skin, with a better complexion, just by having more water alone. 2 to 3 liters a day is enough for you to have great changes naturally and to suppress inflammation. We know that from clinical studies. So that's the biggest thing for me is lifestyle. If I was to choose a second, I would say the supplementations, the collagen, making sure that you are giving your body the nutrients it needs to function at its best. And then everything else after that. So all of your biohacking, your longevity treatments, cryotherapy chamber, all these are indirectly affecting your skin generally, but your body health will improve.
Okay, wow. And you mentioned earlier about your clinic,
Mm,
and I'm curious to know because we've talked about these things separately. I want to pull it all together,
yeah.
and I want to talk about AI in clinic practice.
Mm,
And like, but how would you say your clinic is using AI or integrated software to measure skin
yeah.
and wellness?
So we use AI very specifically. So that doesn't mean we go on ChatGPT and we research all the diagnosis, right? We have AI-derived facial scanning technologies in my clinic. So the AI technology will be able to analyze and assess 3 to 4 thousand different data points on your face and tell you basically on a depth view analysis what your inflammation looks like, your vascularity, so that's a blood supply under the skin, what your pigmentation is like deep and superficial, what the lines and wrinkles are looking like on the surface. It gives a metric, right? It gives a quantitative value, and that's what we want. When we start you on a treatment and we rescan you with that AI technology 4 to 5 months later, and you can see a 67% improvement in your collagen, the numbers won't lie. It's not like I'm fudging the number there. You're having the scan and I'm showing you face value. That's what it is. But the AI tool can be very good for that reason. We also use AI derived technology. So we pair some of our medical devices with our smartphones. We can use AI for that. So giving us real time view on how well we are exfoliating our skin. There's an amazing product I use called the Lumi Spa from New Skin, and that's paired with my iPhone. And it uses an integrated technology. It's the first of its kind to do that. And it tells me how well I'm exfoliating and what pressure I need to use and which area I need to cover to get maximal depth and coverage to cleanse my skin and improve it for what I'm going to put on after. Again, with AI, we've got this, AI derived technology where we're using rise spectroscopy. So this is the scanner I was telling you about before that can use AI derived data to measure specific things in the human body and give you an oxidative score or a score on carotenoid levels in the blood, looking at your level of antioxidant protection. We know antioxidants are really important. They have links to inflammatory disorders, neurodegenerative disorders, Alzheimer's, dementia, things like that, even breast cancer. So when we're looking at, longevity and wellness and holistic care, this is where my clinic takes it a little bit further beyond just cosmetics here. And I want it to be that way. I want it in CAS clinics and my clinic to be medically driven, something that's going to give patients that confidence to think, okay, do you know what? I'm going into an establishment here that's going to not only improve my skin, but make me better overall and help me in ways where I need it the most. And I'm happy to guide direction there.
Hmm. And that technology is wild, like how fast it's all come around. But is there anything that AI has helped you discover that surprised you?
That surprised me. Oh God, I've never been asked that question before.
Go.
I guess when I scanned myself, um, I never had great skin growing up, but it helped me kind of leverage a really good skincare routine, but also look after myself better. So the AI derived technologies have helped me personally on that scale to improve myself. But I was very surprised when I actually had a look into my own skin and seen the horrendous things that were lurking underneath, to be fair, which might be hard to believe, obviously, now when it's all cleared up. But, I think initially when I first got into this industry, I was very skeptical um, about all of it, and I wasn't sure whether any of it worked, as many of my patients are. But I was really surprised by what came back when I had my AI scan, first of all.
So would you recommend someone to start off with maybe like a scan and then work from there to like build up their own personalized skincare routine?
Yeah, absolutely. I think have a scan, see exactly what the skin is showing, what's lurking underneath the surface. That sounds very cryptic, doesn't
Yeah.
it?
Yes.
What lies beneath the surface. But I think we need to know. People want to know, right? Or people might not want to know. I mean, that's the thing. It's like we're going into medical territory here. Do you really want to know certain things? Some patients don't. I personally, I've not done genetic testing and things like that. I know you can get like a blood kit sample. And we do
Mhm.
blood tests in my clinic. We test for certain things, but you can get these tests that look at genetic material, your own, and tell you your risk of developing things like Alzheimer's. Would I want to know that? Probably not. I'd rather not want to know so that I can enjoy my life. But at the same time, I'd also want to know if I was risk of having other things. So yeah, um, it's very much dependent on who I'm speaking to.
Is there a treatment that you guys offer that people would be surprised that even exists and that you'd like to share?
Yeah, I mean, joint injections is always one of them. We use PRP, your own blood, and we isolate the growth factor and inject that into your joints to help with inflammation. A lot of our pro athletes and footballers really do like that treatment to help them when they're off pitch. Again, using your own blood to create a filler. This is the other appeal. We have something called biofiller we use in my clinic. So we actually take your blood, make it into a filler using your own constituents, and then we inject that back into you to help rejuvenate your skin. Stem cell treatments are really popular as well. They work beautifully well. Hair regeneration is the other one. So post transplant or when you're losing, you and I may well be losing hair as males always do in the next 20, 30 years. If you want to maintain that quality, again, that's something not many people are aware of. We definitely do that. So again, regenerative treatments are always well received.
Kasim, thank you so much. This has been amazing.